Okay, I'd like to go ahead and get started with the life-saving benefits of magnesium therapy. And I'm very excited to bring this presentation to you because over the years, I would say that out of all the supplements I've used and added in my practice, this would probably take the cake for the one that's made the biggest difference in my patients after using Essentials multivitamin and also the omega. So today I'm hoping that I'm able to leave you with some information about magnesium, why, when, and how to use it. And as many of you know who follow our model, our belief is that the body is miraculous and can reverse disease if we are able to optimize the way the body functions through optimal levels of hormones, optimal levels of nutrition, optimal ability to remove toxicities, and most importantly, the pH of the body, which is maintained by our fluid intake. Drink your water. The effect and the balance of the mind, subconscious controlling 90% and the conscious mind controlling 10%, and of course the physical structure of the body, the blood vessels, the lymphatics, the muscle, and the bone. And we're aware that the stressors on the body and the stressors on the mind have a big impact on how much fuel we actually need to use. So the more activity we have, the more fuel we need. Magnesium is on the periodic table, and its atomic weight is 24. And I think this is important to take a look at simply because magnesium's charge is 2+, which means that when we talk about the effects of heavy metals on the body, we realize that what heavy metals like lead and mercury and cadmium that share the 2+ value, what the effect they have on the body is effectively to displace magnesium, which means they're displacing magnesium from the nervous system, the cardiovascular system, the muscular system, the ATP system, and that is why there are so many effects of having heavy metals in our body. And as a matter of fact, there have been studies to show that if you take the magnesium at a high dose, either orally or transdermally, you actually are able to get rid of some of the heavy metals. So this is actually a detox mechanism. But magnesium is a very important mineral in all of life. A green plant will quickly show you that it's magnesium deficient with yellow. I've corrected a lot of my palm trees in my yard just by pouring some Epsom salt at the base when the leaves turn yellow. In humans, we know that these nutrient deficiencies present with symptoms such as weight gain and sleep issues and anxiety, headaches. All of these can be direct symptoms of being deficient in magnesium. And if you are going to be deficient in one mineral, I can tell you that the one mineral I find most commonly deficient is magnesium. So therefore, not only will that cause symptoms, but it'll also eventually lead to diseases of the body, in the bone, the muscle, the cardiac system, organs, nervous system, so on and so forth. The European Food Safety Authority has authorized several health claims for magnesium, including its effect on tiredness and fatigue, electrolyte balance, energy yielding mechanisms, nervous system, muscle function, bones, physiological function, and maintenance of normal teeth. It's important, and it also has a role in cell division. It's important for us to realize that these claims were able to be made simply because there's plenty of data to support it. In addition to symptomatic effects, we are now aware over the last 10 to 15 years that if you have a nutrient deficiency, it will cause DNA damage. And that DNA damage turns into organ damage and eventually into things like cancer. That's the epigenetic effect that we know of, and we're also very aware that we can measure magnesium levels. I like to measure them in the serum, which is easy. but I find that the SpectraCell intrafunctional analysis of magnesium gives me an idea of what's getting into the cell, and that ends up becoming relevant. But these micronutrient deficiencies are known to be a major cause of DNA damage. And the great news is that in 2012, a European journal published that if we correct the micronutrients, we actually correct the DNA damage. This DNA damage in the case of magnesium is going to extend to anything that hits any cell membrane, because magnesium is a major part of every cell membrane mechanism, and therefore its effect goes to our arteries, vascular system, nervous system, bone, mitochondria, energy. The cellular effects of magnesium are impossible to completely enumerate, but you can see in this diagram every step requires magnesium. This is two nerve endings. This is actually the GABA receptor, which is very relevant because low magnesium literally means low GABA stimulation, which means anxiety. And this is one of the reasons why when we're treating anxiety, magnesium is going to be a mainstay. Is it treating something, or is it really correcting a deficiency? Well, when I measure magnesium levels in these people, usually they're extremely low. Magnesium is critical for cell division. And if you look at every step from transduction to transcription, protein synthesis, duplication, mitosis, messenger RNA, has a magnesium connected to the ATP. And it's so critical in ATP production, if any of you are familiar with Stephen Sinatra's data, that he came up with a mainstay formula of CoQ10, magnesium, D-ribose, and L-carnitine to correct cardiac deficiencies, as you see in AFib, arrhythmias, congestive heart failures, and paroxysmal atrial tachycardia. I put these in red. There's many other indications, but I can tell you that I put these in red because by using this regimen, I have been able to reverse the medications on over 80% of the patients that have been on medications for these kind of conditions. The mainstay of that therapy ends up being magnesium. And if they're under more stress, they're losing more magnesium. The magnesium also blocks nerve excitation. We know that magnesium binds to the NMDA receptor and blocks activation, which means if we're low, instead of having alpha waves, which are the second line, we're going to have more beta waves, more nervousness, more anxiety. The causes of this deficiency include things like intake, absorption, alcohol, but really the main cause that you're going to find these days is going to be related to anything that stimulates the nervous system. That means stress, physical exercise, a cell phone that rings or buzzes is going to use your magnesium, which means if you are under a lot of stress and you believe that you are depleted and tired, you want to preserve your reserve and turn that thing off. And there's actually good data now coming out on a regular basis about the benefits of doing this. If you read Time magazine this month, their special edition covers this in great detail. The proton pump inhibitors, like proton pump inhibitors that we use for heartburn and reflux, cause magnesium deficiency. Diuretics cause magnesium depletion. But I'm still going to tell you that the major thing that causes it is going to end up being stress and overstimulation. Magnesium functions include anything that works on the muscle, nerve, and vessel spasm. So the symptoms that I have been able to correct using magnesium alone are things like anxiety, muscle cramps, restless leg syndrome, so many patients coming off their medications when the dose gets high enough. But one of the things to remember, this dose, even at the maximum dose and the correct dose, the studies show that it can easily take 12 to 24 months to correct intracellular magnesium. So it isn't enough to start a patient, tell them to max out, and then stop taking it. They literally have to keep taking it for 12 to 24 months before they start to pare it down. Insomnia, headaches, and migraines. We know that headaches and migraines are a direct result of vascular spasm that's triggered by cold or hot, any kind of smell, allergies, hormone fluctuations. But at the base of it always lies fluctuation of the vascular system. So many of these patients have been corrected by magnesium alone. Painful periods. Allergies, because it's responsible for mast cell stabilization, constipation, the osmotic effect, and fatigue. And therefore, by treating these symptoms, we've also been able to correct many of the associated diseases that you see on the other side, like asthma, like diabetes, like high blood pressure. And of course, we're using other things too, but the reason why I say that life-saving benefits of magnesium is because in my practice I've noticed that magnesium happens to be the one thing that when I add it and max it out and keep it steady is going to make one of the biggest differences. Low magnesium causes vasospasm, and it's been found in those with migraine and headaches to be correct. This study just shows that up 600 milligrams a day of magnesium works for migraine prophylaxis and significantly reduce the frequency of migraine. And I can tell you that I use much higher dose than this, and it can even treat migraine. I've had some patients who I've treated with 1 to 2 grams of IV magnesium for acute symptoms, as I have used in asthma. And of course, the data supports that too. The American Academy of Neurology agrees with this. Magnesium corrects constipation. This is data. I won't go through it in great detail because you'll have access to it when this webinar is on MD Prescriptive's website. But it reduces restless leg syndrome by over 50% because restless leg syndrome is literally a magnesium deficiency syndrome. So it's very nice to see these patients get off these medications. Muscle cramps, as soon as you load it up, you should be seeing those things go down very quickly. Many studies showing exactly that. PMS cramps, anything that has to do with spasm of the muscular or the nervous system is going to benefit from magnesium. It stabilizes the mast cell membrane, so this is provides a great use for it in asthma and seasonal allergies. Again, these are just studies that you have access to, and again, a study showing its effect on IV on asthma, acute asthma. And it turns out in this case that actually oral magnesium had no benefit, and I have noticed that oral magnesium will have a benefit in asthma, but it takes time. It will have an effect over months. Whereas if you have somebody in an acute attack and you have access to IV magnesium, it's one of the things that one can use. Because magnesium is a critical part of the insulin receptor and the zinc mechanism that controls the insulin receptor, it is very useful in lowering the insulin mechanism and the diabetic drug requirement in patients. And there's several studies that have shown this using just very nominal amounts of magnesium, like 100 milligrams a day. Again, many studies showing the inverse association. And of course, they used mag oxide in this study. I'm going to share with you why I really prefer to use magnesium glycinate and acetyl taurinate, mostly because magnesium oxide is not bioavailable. But you remember I've been telling you about the lipid solubility, and it turns out that the taurinate is lipid soluble, so its effect on migraines and muscle cramps and ATP is going to be much better than just a water soluble alone. We learned over the years that calcium supplementation doesn't do much for the bones and actually increases heart attacks and strokes. That was much to our chagrin, but it turns out that magnesium is actually the key to the healthy bones, and there's plenty of studies showing its effect on osteoblasts and osteoclasts and also on parathyroid hormone. It is important to suppress bone turnover. and it's linked to congestive heart failure, angina, and myocardial infarction. Again, I give you Stephen Sinatra's protocol because I can't tell you how many people I've been able to reverse in terms of cardiovascular issues just using this simple protocol. And usually the benefits of this are seen within a week. Obviously, as I've told you, to see a complete result, you need to continue it for as long as possible. This therapy is actually recommended by the American College of Cardiology for many indications, as you can see, including VTAC, rapid AFib, and ventricular arrhythmias, and even in ischemic heart disease and stroke. So there's lots of slides I present here just so that you actually have the data and the bibliography, so you have something to back up using the magnesium if you need it. Of course, those of us in obstetrics know about its effect in preeclampsia, and my proposition here is that it really has its major effect on the cell membrane of the nervous system. So that's how it works in preeclampsia and eclampsia, and I don't think I ever knew that when I was using it in practice to prevent these. So how do we actually get the magnesium up? And the nutritional program that we use in the center, Sojun Institute, really has three components, and you can guess that measurement's the main one, but more importantly, food is the major way we correct things. Now, are we going to use only food when we have big issues? Absolutely not. We usually put people on basic supplements, which include Essentials 5-in-1 and RX Omega. And then now I'm finding that the most important next supplement turns out to be magnesium. The more stress we have, the more chaos we have in our society, the more cell phones and Wi-Fi and neurological stimulation that we have, especially our children. You may know that our children are bombarded with almost 1,000 times more information per day and have more nervous system stimulation than we ever had growing up. So magnesium becomes very important. And this is the system I use to measure. This is an antioxidant function, and this is basically a SpectraCell. I'm looking for 75th percentile. And the most common deficiencies that we find when we're doing these, you can guess, are the ones that we would expect. But magnesium, B12, and folate are critical ones. Our top food sources of magnesium include things like cashews and black-eyed peas, and oatmeal and wheat bran. There's many sources. We know that chocolate would be a good source, raw cacao, and these are things that we give people in our food program. Everybody has to go through the dietary program. But you're not going to take somebody who's magnesium deficient and symptomatic and give them food alone. So you end up using some supplements. And as a base, we're always using the Essentials 5-in-1 with the methylated tetrahydrofolate and magnesium glycinate at 100 milligrams, which really isn't enough for what we need. Magnesium is a tricky thing because if you put more in, you end up having to add more capsules because the amino acid forms happen to require a higher capsule count. And then, of course, every patient goes on RX Omega. But when it comes to magnesium supplementation, the recommended daily allowances that you see are significantly below any of the studies that you noticed that I quoted, that were using 600, 800, some of them 400. But my clinical experience has been that you have to use significantly more, especially in the beginning. So this is something to know. The next thing that becomes relevant is what's the form. Most of the magnesium on the shelf, if you go to GNC or any of the supermarkets, are going to be in the form of magnesium oxide. And the issue with magnesium oxide is, of course, bioavailability, and I'll talk about that in a second. But there's many forms, and I think it becomes extremely confusing when you're looking at magnesium forms and wondering which one to use. The fact of the matter is that aside from oxide, which is basically a form of would be a form of rust in the body, it turns out that any mineral that's an oxide is going to oxidize the body. And we know that most supplement companies use oxide simply because it's the easiest way to get the largest dose in one pill. But after that, all of the amino acid chelates, which are more bioavailable because they're using the amino acid transport system in the intestines, they all have their benefits. They all have different target organs, and it's a matter of choosing something that's cost-effective and tolerable in the patient. And I have personally used every form of magnesium that is listed over here. I started out with magnesium glycinate early in my practice, about maybe 6 years ago. It's in the form of magnesium glycinate. One thing I quickly learned is that if the label doesn't have magnesium glycinate in a parenthesis, then they're giving you the amount for the magnesium glycinate. So 120 of magnesium glycinate in parentheses is actually 120 milligrams of magnesium. Whereas the second one, which doesn't have the parentheses, is only 18% of 120 milligrams. So the magnesium is only 22 milligrams. So you always want to make sure that the parentheses are rounded. And the important thing to realize is that the higher the percent of magnesium, like you see magnesium oxide on the left side of the page, the lower the pill count. And this is where it becomes hard to recommend magnesiums like lactate or amino acids, because they are always going to have a higher pill count, but they will be the ones that we are going to recommend because we've had a lot of experience with them. And those are the ones that work better. These are just studies showing that magnesium oxide is less bioavailable. Many studies that show this. Transdermal magnesium is extremely absorbable, and I use this form generally when I'm trying to use it, or I use it in a form like an Epsom salt. And I use these primarily when patients are unable to tolerate oral magnesium because of gastric disturbance. I ask them to spray 20 to 30 sprays at night in any area that hurts, and every 8 to 10 sprays is like 100 milligrams. So it's a pretty decent dose when they get to 30 sprays. You'll hear a lot of patients coming in and saying they use Calm, which is a citrate, many different flavors. It really is not a terrible form of magnesium at all, and it turns out that it is organic. But this is not going to have half the effect of the magnesium glycinate ATA that you want them to use. So this is the one that I began to use about 3 years ago when we added the acetyltaurinate simply for its lipid solubility. And ever since I have added that, our results have been even better. So this basically combines glycinate at, you'll see the label, 150 milligrams with taurinate at 50 milligrams. And the benefit of taurinate is that it makes both forms more bioavailable and also lipid soluble. So let's look at that. Magnesium glycinate is transported by active transport systems. Minerals normally diffuse passively. That's why it's always a good idea to hook your minerals up with an amino acid. Taurine has independent functions in the cardiac membranes, transmembrane ionic movements of the neurons, and it's lipophilic. It goes through the blood-brain barrier, and because it goes through the blood-brain barrier, we've been able to use it for migraines, neuronal migraines, cardiac arrhythmias, convulsions, seizures. This is actually a study showing the decrease of acute seizures with the magnesium ATA, and in addition, no recurrence. But my own experience in treating patients with seizures, I actually have a young patient right now who I treated with high-dose magnesium. She's 18 years old. She was having a seizure daily, and with the use of high-dose magnesium and progesterone, we were able to stop it. And they were not treatments. They really were correcting deficiencies, which we were able to prove when we measured the intracellular magnesium and the progesterone. Why would a young girl be low in magnesium and progesterone? Most young girls these days are low in magnesium and progesterone because of too much neuronal stimulation from all the things going on, and also, as I'm mentioning, the stimulation that comes from the World Wide Web and the Internet. How I use magnesium? I use it in every single patient because on the whole, it is one of the most common mineral deficiencies, especially in those who have a lot of nervous system activity, such as those with high stress, anxiety, and weak adrenals. I always instruct the patients to take as much as possible without getting loose stools. All patients should be on 400 to 1,000 milligrams per day. The Magnesium RX has 200 milligrams per capsule. I ask them to take it in the AM and PM and work from 1 capsules up. We expect those with low adrenals to need a higher dose. I have a few patients that are on 10 capsules a day, and after 3 to 4 months, they go down. The aim is to take as much as is tolerated without diarrhea or loose stools, and to stay on the maximum tolerated dose for 6 months before reducing the dose to maintenance of 4 capsules. If symptoms recur or stress recurs, they need to take it back up. Typical example, I have a patient on thyroid, totally stable, completely stressed out, ends up forgetting to take magnesium. A month later, ends up in the emergency room with tachycardia and anxiety attack. And historically, you take the history and they stop taking their magnesium. So magnesium is very important in this day and age. It's life-saving, as I said, in all of the associated conditions, and I have used it in all of these associated conditions. I can tell you that you cannot build bone without magnesium in the picture. Plays a critical role in making ATP. So I always first load with magnesium for these conditions: adrenal weakness, anxiety, stress, and always before the thyroid. Why do I? And it doesn't really have any toxicity because in a healthy individual, the kidneys will eliminate excess, and that's been published in the nephrology literature. For thyroid patients or those with anxiety, I increase the magnesium dose 1 to 2 weeks before starting or increasing the dose. If there's any heart palpitations or increased heart rate, you lower the thyroid dose and increase the magnesium dose, and then you retry the increase in thyroid again in 1 to 2 weeks. This instruction is given to every single one of my patients. My patients are instructed that if they have too much stress, they should increase their magnesium dose and possibly decrease their thyroid dose, because as you know, these things don't stay steady. An example of something that I saw many times early in my practice and never knew what to do with it is right here. A 45-year-old with low energy, panic attacks, and insomnia. Obviously, my first route is going to be to give this lady some progesterone to calm down the panic attacks and insomnia. I started 12.5 milligrams slow release, and instead of sleeping and having no panic attacks, she's hypervigilant, she's up all night, she's having panic attacks, her heart is racing, she's nervous. And what has happened? This would be your typical paradoxical reaction to progesterone, which you will see in your practice as you see more and more people. And as we get her labs in, we see that her DHEAS is less than 1/3 of where it should be, cortisol is less than half, progesterone is 0. We know we're dealing with an adrenal situation, so we have to load with magnesium, calm the nervous system down with omega, give her some DHEA, and either restart the progesterone at 12.5 oral or give a sublingual progesterone form, which can be titrated even in the morning. Slowly, as the patient's magnesium dose goes up, you're able to correct this. So if you ever give somebody a progesterone or a DHEA or any of those, pregnenolone, and you get increase in heart rate and nervousness, you can guess that it's probably shunting straight to the cortisol pathway, and the best way to correct it is by giving high-dose magnesium. If you get diarrhea from the osmotic activity of magnesium, I usually end up recommending Epsom salt baths, transdermal magnesium as I recommended, and a little bit of baking soda. This is actually a great relaxing way to end the day if this magnesium stings. You know, this would be analogous almost to us going into the ocean, the salty ocean, not with the hurricane in it as it is today, but the salty ocean, and dipping our bodies for about 20 minutes to absorb the magnesium and the minerals. If it stings, like the ocean can, you mix with olive oil or coconut oil or lotion. I've successfully used magnesium in this way. In addition to the other two supplements and the food, ultimately measurement always provides motivation. And many times when patients are not convinced, I just measure and motivate. Now, if it comes out in the 30th percentile, it's not good enough. You really want it above the 75th percentile. These are some general references. And I'm coming to the end of this webinar. I just wanted to mention to you, you guys will be getting a notice for the next webinar, which will be why I recommend Essentials 5-in-1 for every patient. I will be speaking in PCCA Vancouver in November and at A4M in December. And I have time to take some questions if there are any. I hope you guys have lots of fun using magnesium. And if anybody has any questions, please ask them. Okay, so the first question that I have has to do with what I was talking about with the thyroid and the palpitations. The question is that, do I use thyroid in patients who have adrenal insufficiency? And you may know that it's typically taught that one first corrects the adrenal and then starts to treat the thyroid. What one finds is that when one treats the adrenals first, it can take a long time and it can become extremely depressing for the patient as they're waiting for their adrenals to correct. So what I've learned over the years is that if I load the magnesium and the progesterone and I teach them how to use mechanisms like heart math breathing, heart-focused meditation to calm the nervous system down, I'm able to use natural thyroids at 1/4 of a grain, either WP thyroid or Armour thyroid, and I'm able to use that effectively and slowly to increase the energy instead of waiting for the adrenals to completely correct. I hope that answers the question. The next question is regarding the use of magnesium in allergies and what my actual clinical experience has been. So this is a good question because I think that one of the things we have all been seeing lately is patients coming in through the door and asking us if they can get ALCAT testing or testing for allergies for food. And what I've noticed over the years as I do these tests is that people who are having any kind of gastric symptom or have any kind of adrenal insufficiency generally have mast cell instability, which means when you test them for these things, they're going to end up having many more symptoms and many more allergies than you would expect. And as time goes on, they only have more and more allergies. So what I've found over the years is that giving the magnesium at high dose to the level of tolerance actually reduces the number of allergies because it reduces the firing and the instability of the mast cells. So as you start to correct gut inflammation with probiotics and enzymes, which I'll be covering in a different lecture, and actually it's on MD Prescriptive's website, but as we correct gut inflammation and we provide enough magnesium to stabilize mast cells, it turns out that they're not triggered that easily. So the allergies and the number of food allergies actually go down. So I find that the right time to test for food allergies, if you want to test for them, is after the gut is corrected, and after you've dosed with magnesium high enough that you know that the symptoms will not be related to mast cells being unstable. So we've gotten to the end of our webinar, and if there's any other questions, I can take them on the MD Prescriptives website. And I really am very grateful that you have chosen to spend some time and join me to learn about magnesium, and I hope it makes as much of a difference in your practice and your life as it has in mine. And thank you.